I like to talk to my patients about cancer prevention and the psychological toll cancer can have on patient and the family. My name is Dr. Sandhu. I'm a medical oncologist at Tammy Walker Cancer Center.
Dr. Sandhu, thank you for coming on the show, and we're going to be talking, at least starting out, cancer prevention. Why don't you talk about cancer prevention?
So when we talk about prevention, we have to remember two things. One, inflammation, and second, cancer screening. So things that cause inflammation in our body, we need to prevent those. What is that? It's being overweight, eating too much McDonald's or just outside food and less vegetables, not eating enough beans or vegetables in general. Everybody's living quite stressful lives nowadays. And when we're under a lot of stress, we have high cortisol levels in our system, which is a stress hormone and it's an inflammatory. Then we should do our normal screening tests. For ladies, their normal pap smears and mammograms, which have shown to save lives. And for men, routine colonoscopy at age 45 or 50. But if they have familial risk and high risk family history, then probably sooner.
One topic you want to touch base on was the psychology or dealing with the emotions with somebody who gets a cancer diagnosis.
Cancer diagnosis is one of the most traumatic things that can happen to any human being, because it seems like a death sentence for everyone who gets diagnosed with it. So it's very important for the person who gets the diagnosis to be aware of this factor, that it's okay if they feel overwhelmed, and it's okay if they go to counseling, and it's okay if they go to a psychiatrist, and it's okay if they have to be on antidepressants while they're undergoing treatment. Because a lot of patients tend to get depressed. Even the most resilient patient can get depressed during treatment, because the treatment itself and chronic, any kind of sustained stress, it decreases the serotonin level in our brain. So all the physicians have to do is just give them some antidepressants, which normalizes their level, and they feel much better, and they can deal with their situation much better.
And I would think with a better attitude, a lot of times the treatments probably is more successful,
sure.
Right?
Sure. Treatment is more successful, and it's less trauma for the patient.
Thank you for watching. For more information, you can visit the Cancer Services tab of Srhc.com. Like us on Facebook, follow us on Twitter and Instagram.